Thank you, Madam Chair. Madam President, I would like to, in speaking to both of these amendments today, make a couple of observations about the reconciliation bill that's before the Senate. And of course, it does make amendments and modifications to the Senate-passed health care bill that went through the House last week, and the House adopted many of these changes. But I think that the thing that perhaps didn't get discussed as much as it should have throughout the course of the debate, Madam President, is the impact this is going to have down the road on future generations. You know, obviously, health care, we talked about. The other side, of course, talked about the coverage, the additional expansions of coverage that are in the bill. Folks on our side talked about the impact that it's going to have in form of higher taxes on small businesses, the Medicare cuts that are going to impact seniors across this country, the higher premiums that many Americans are going to be faced with. Those are all still fundamental features of this bill, and in fact, many have gotten worse through this reconciliation process because the tax increases are now $50 billion higher than they were before. So now you're raising taxes even $50 billion more than you were previously, which was $500 billion. The Medicare cuts have now gone from $465 billion over 10 years under the bill that left the Senate in December, and the Medicare cuts now have been increased by $66 billion. So you are raising taxes more, cutting Medicare even deeper, and at the same time adding gimmicks that I think understate the true cost of this bill. We've all talked about this throughout the course of this debate. The other side has said, well, it's $1 trillion bill, or 900 and some billion, over 10 years. But if you look at the way that it's scored, you have 10 years of revenues, 10 years of tax increases, only 6 years of spending, so that understates the cost of it in the first 10 years. You have a number of other budget gimmicks, some of which I'm going to refer to in just a moment, that understate the true cost of it. But when you look at it when it's fully implemented, and I think that's the issue, that's the number that the American people need to focus on. When this is fully implemented, it's $2.5 trillion in expansion of health care in this country, and it's going to be greater intervention than we've ever seen before by the federal government in the delivery of health care in this country. But I want to speak for a moment, Madam President, because one of my amendments deals with this issue of how the cost of this is being understated because of these various gimmicks and tricks that are being used. The Class Act is a program that is created in the bill, and it's a program where there is an assumption that there is $70 billion available in the Class Act to pay for this new health care entitlement, and what it does is it creates a new entitlement. Not that the existing entitlement programs that we have that are already on their way to bankruptcy aren't enough. We now have to add another one to it. So the Class Act is a long-term care program, entitlement program, which in and of itself perhaps isn't a bad idea if it were structured correctly and if it were actually the premiums that are going to be paid by people for long-term care insurance, if those premiums were actually going to go into the payment of benefits. But what this does is it assumes $70 billion from this new Class Act program, the proceeds from which would be used to pay for this new health care entitlement program. And so it overstates the amount of revenue that is coming in by $70 billion. And here's why. At some point, if you're an elderly person or even a younger person perhaps today who wants to buy into this new Class Act long-term care program, you would pay premiums. Those premiums allegedly would go into a fund that would be then available to pay benefits when the time came to pay benefits. That's not going to happen, because you're taking that $70 billion and you're spending it on this new health care entitlement. And so at some point in the future, when those people who have gone into this program thinking that they're paying these premiums so that they can derive a benefit at some time in the future if they need to, when the time comes to pay out that benefit, there won't be any money. And so what happens? It's borrowed. It's added to the debt. So you've got another $70 billion that goes on the backs of our children and grandchildren to pay for this new entitlement program and to understate the cost of this bill. So that's the Class Act bill, and my amendment would strike that from the underlying bill. Now, by the way, I offered that during the debate here on the Senate floor during the health care discussion we had the first time around here, and I got 51 votes for it. There were 12 Democrats who voted with me in support of taking the Class Act out of the bill. Now, one of the reasons I think that there's so much bipartisan opposition to it is because everybody recognizes what a sham this is. The chairman of the Budget Committee from North Dakota, Senator Conrad, said this is a Ponzi scheme of the highest order, something that Bernie Madoff would be proud of. That's what he said about the Class Act. And even the Washington Post went so far as to make the statement that the the Class Act is a gimmick designed to pretend that health care is fully paid for. That's what the Washington Post editorialized about the Class Act. A gimmick designed to pretend that health care is fully paid for. So you take that $70 billion off of the overall revenues that come in under the bill, and you're already creating a $70 billion hole. Well, you add to that, there's $29 billion in Social Security payroll taxes that are assumed are going to come in as people who get hit with and employers who get with the high-end Cadillac tax, currently paying out their employers in the form of health care benefits that are tax-free, start shifting to cash compensation, which would be taxable, therefore payroll taxes would apply, that would generate another $29 billion in Social Security payroll taxes. But there again, those are payroll taxes that at some point are going to have to pay benefits. But we don't assume that here. We assume that it's going to go to fund this new health care entitlement program. And so it's another $29 billion that at some point in the future, when somebody decides I want to draw my Social Security benefits, they're not going to be there. Therefore, we put it back on the debt, more borrowing. So now I've got $70 billion, $29 billion. And then you've got the implementation costs of this, which CBO has not fully given us because they don't know what it's going to cost in the out years. But based upon what they've given us in terms of what it's going to cost in the near term, we've extrapolated that it's going to cost about $114 billion to implement this new health care extravaganza that's going to be run out of Washington, D.C. And so when you add that on to the cost of none of which is accounted for in the underlying bill, you've got another $114 billion to cost this thing, not paid for. And then you take this, the Medicare double counting, which is really interesting because you have these cuts that are going to occur in Medicare. You've got these payroll tax increases that are supposed to occur in Medicare that are going to generate collectively $29 billion in additional revenue. But here again, Madam President, what's wrong with this picture? The assumption is that these are Medicare payroll taxes that are going to go into a Medicare fund that at some point in the future will pay Medicare benefits. And yet at the same time, we're saying these Medicare revenues are going to be used to finance this new health care expansion. And so what are you doing? You're double counting. You cannot spend that money twice. We are taking $529 billion in Medicare cuts and Medicare payroll tax increases that supposedly would go into a Medicare trust fund to pay benefits at some point in the future to beneficiaries, recipients of those funds. But no, we're going to take that, we're going to spend it on this new health care entitlement. What happens then? Someday in the future, that Medicare recipient is going to say, okay, it's time to pay out these Medicare benefits. I've reached the appropriate age, I'm eligible, and I want to get into the Medicare program. And all that money that was supposed to have been in the program to pay for those benefits isn't there. Why? Because it was spent on this new health care entitlement program. And so what happens? To pay those benefits, the federal government will then have to borrow more debt that goes on the backs of our children and grandchildren, another $529 billion. Okay, so the last point I'll make, because I've got another amendment that addresses this issue. But this reconciliation bill did something that obviously was not included in the health care bill that passed the Senate the first time, and that is this takeover of the student loan program in this country. Now, it's something that's been proposed around here for some time, but as you know, Madam President, the way that student loans are distributed across the country today is you have 2,000 lenders out there who make these loans. Students can go there, get those loans. What this will do, will eliminate that model. We'll draw all these student loans into Washington, D.C. You'll have 4 federal call centers where students will go to get their loans. And what does that do? Well, first off, it kills a lot of jobs. I have 1,200 jobs in South Dakota that are related to student lending business, and those are all now going to be bureaucrat jobs here in Washington, D.C. There are 31,000 jobs across the country where you've got people who are working in the student loan business. Those jobs are in jeopardy because that's all going to be drawn into Washington, D.C. I don't think the American people have effectively yet focused on what's being done in this reconciliation bill above and beyond the really bad stuff that's related to health care. So you've got this now student loan program, which is coming back into the federal government, and a lot of the revenues now are being earmarked for other things. They're being earmarked for the health care bill. $9 billion is being used to pay for the health care expansion. $10 billion is going toward, quote, deficit reduction, but you've got another $19 billion coming out of the student loan program. And who's going to pay for that? Well, students are. Students are going to pay for it in the form of higher interest rates on their loans. So essentially, we are now not only taxing small businesses, cutting Medicare recipients, but we're also taxing students to pay for this expansion of health care. So you got another $19 billion, which at some point in the future, of course this is all going to have to be paid for again by our children and grandchildren, but you've got all this double counting that's going on and all these gimmicks that are being used to understate the cost of this thing, and when you add it all up, $143 billion deficit, or so-called budget savings, ends up in a $618 billion cost. So in other words, instead of running, as the other side has said, $143 billion budget surplus because of this health care expansion, if you take out all the gimmicks, the Class Act revenues, the Social Security payroll tax revenues, which are double counting, the Medicare double counting, and the student loan program, you've got a real deficit of $618 billion in the first 10 years, and if you extrapolate that out into the second 10 years, it's $1.8 trillion that will have to be borrowed under this bill to pay for the cost of it. And that's the cost that we know today. And that's all going to be passed on, Madam President, to future generations, to our children and grandchildren. That is the dirty little story that hasn't been told in this whole debate, is how much this is going to cost future generations because of the enormous debt that we're piling up and all the games and the gimmicks and the tricks and the chicanery that are being used to understate the true cost of this. $143 billion stated, quote, savings in this bill. When you take out all the double counting, all the gimmicks, end up with a $618 billion deficit in the first 10 years. That, Madam President, is tragic. That is why I am offering this amendment to strike this Class Act. We shouldn't be creating another new entitlement program when we can't pay for the entitlement programs that we have. They're all going bankrupt. And we're going to create yet another one, which is going to lay more debt on the backs of our children and grandchildren. And the other thing I'll mention just briefly in closing, Madam President, and speaks to the other amendment. The other amendment, as I said, because of this takeover of the student loan business in this country, there are lots of states that are going to lose significant numbers of jobs. My state of South Dakota, as I said before, has over 1,200 jobs related to student lending. If you look at the Midwest even, Minnesota 675, Iowa 526, Nebraska 891, there are lots of places around this country where student lending creates jobs, private sector jobs. We're going to do away with those and bring all those jobs back in here to Washington, D.C. and make students come to Washington to get their student loans. And as it turns out, at a higher cost because we're using some of the proceeds of that program to pay for the cost of the new health care program. But what my amendment simply would do is say that the Department of Education has to certify that there will be no jobs loss across the country associated with this takeover of the student lending business and bringing all that power and consolidating it all here in Washington, D.C. So those are the two amendments that I offer, Madam President. I hope that my colleagues will vote for those. This is bad policy in so many ways, but taking over yet another industry in this country that's creating a lot of jobs and therefore killing a lot of jobs is the wrong way to move forward when you're trying to pull an economy out of recession. Madam President, with that, I yield the balance of my time.